window shopping in medical treatment. Today what happened? We are used to doing window shopping everywhere. Now suppose you have a small back pain. First thing is you should go to your own family doctor, known doctor, or a nearby normal doctor. Don't go to super specialty hospital and directly orthopedic surgeons because he's a specialized doctor. He has a lot of works to do. For a small back pain, it may go off within no time. And secondly, by chance if you approach one doctor, he gives you some advice. Without telling him, don't jump to the other doctor. In a window shopping, you can jump one shop to shop, but you should not jump doctor to doctor too many times because at the end you will get confused. Then third problem is after consulting 3-4 doctors, then you Google. Google will put you in ocean. Google has a lot of knowledge. He will confuse you more often and approach is different. So doctor treats you with human touch and he knows you by your heart and body, especially if your own doctor. So he is the best person to treat you. If you are not satisfied, tell him no. Doctor Sahab, I am not very comfortable. Please do something else. Or if you wish you want to send it to somebody, you send. Don't every day ask, refer me to consultant. Then you'll get fed up, okay, jao maro, go, he will send you. Don't temper the doctor because doctor has spent, he studied, wrote exam of MSET like competitive exams. With a great difficulty, he gets one seat. Then he studies 5 to 6 years MBBS, house surgeonship, senior housemanship, PG seat is big Olympics again. Then he studies 3 years. Still nobody pays money. Nowadays better. In our time nothing was there for PGs or house surgeons. And then with all this experience, he will use to help you. You can't become a doctor by studying, you Google or any kind of material in the net. So don't do that. Google IQ can be dangerous for you and confusing for the doctor also. I'll tell you a simple example. People come to me, tell me, Doctor Sahab, mera cholesterol बढ़ गया. My cholesterol is very high. Oh. How much? 200. So what? 200. Arey Baba, cholesterol is up to 250 is still normal range only. 150 to 250 is still normal. It's all depends upon how much good cholesterol you have, how much bad cholesterol you have. Is your lifestyle is related to cholesterol disease or it is genetic? Familial hypercholesterolemia, idiopathic hypercholesterolemia or hypercholesteremia, dyslipidemia due to diabetes and other diseases. These are very, very specific and it's a doctor's job to diagnose. Don't mislead him. Another example I'll tell you. I'm writing a prescription, gabapentin. One boy is, Googling. Sir, gabapentin gives you suicidal tendencies. I said, go do suicide. And when doctor thinks to write one drug, he also thinks whether it's useful or not. Are there any drug interactions? Does it have any side effects? In spite of so much of thinking, still drug can have side effect. Small aspirin can kill you within no time. So these are the important things. And don't read the reports. Every lab has got its own kit mechanism. And their reference ranges are different. From Vijaya to Tenet to for 1mg to Tata, whatever it is, all the good labs. Their all reference ranges are different. So what are we doing? You're reading and then immediately telling the doctor, please, my LDL is high. In fact, some patients come, they don't tell about their problem. First they come, sir, my LDL is high. Another person says, my L4-5 is gone. I said, what is the L4-5? Can you give full form? Can you give nerve supply, blood supply to L4-5 disc? They don't know. Why you want to break your head? We are there to break our heads to maintain your health. Don't do window shopping in medical sciences. It can be dangerous for you. It can be confusing for a doctor. No doctor willfully cause any damage to you. No doctor willfully will ever give you a wrong prescription. No doctor will ever give you a medication with a willful reaction to occur in your body. Never it will happen. They are also human beings. In fact, they are in touch with more human beings. They are more human than you. All the time, you common man is thinking about money and money and money. Doctors do make money, hospitals do make money, but that is an outcome of the profession. But doctors are never Thomas Gun people. They are not, wild and weird or dangerous to population. Most of the doctors are human in nature. Please respect them. They can also make mistakes because there are no diagnostic guidelines precise for malaria or typhoid, exactly same in person to person. That's why Supreme Court gave a verdict. For your wrong diagnosis, misdiagnosis, doctor cannot be penalized because there are no standards. And you cannot believe everything by testing. Pain in the abdomen, if you put your hand, you'll come to, does it dovey feel? Or it's a cramp, or it's a tenderness, or a bloating? So much are different. Everything you cannot get from test. Yes, you may insist your doctor to examine you. Don't get an MRI done without your doctor touching your knee joint. Yes, I agree here. Doctor's at fault. Don't take any test unless your doctor at least touches, if not pulse, at least some examination. I also request my colleagues, you must touch them at least. So it is a good relationship between a doctor and patients, long lasting. All my clients, I'm very, very happy because they are like my family members. I'm their family doctor. Anytime they talk to me, they message me. So I am thankful to them because they don't do window shopping to me. In fact, I am the last window for most of my clients. Take care.